Bismillahirrahmanirrahim. Assalamu alaikum. Today inshallah we will discuss another topic which is introduction to abdomen. The abdomen is the lower part of the trunk and it lies below the diaphragm. See here in this diagram, this is the diaphragm, which is a muscle which is separating the thorax from the abdomen. So abdomen is the lower part of the trunk and it lies below the diaphragm. It is divided by the plane of the pelvic inlet. See here, this is the plane of the pelvic inlet which is dividing this whole part of the trunk into an upper part, which is the abdomen proper, and a smaller lower part which is the perineum and the pelvis. The true pelvis or the lesser pelvis and the perineum is below the pelvic inlet and abdomen is above the pelvic inlet. The abdomen is bounded to a large extent by many muscles which can easily adjust themselves to the periodic changes in the capacity of the abdominal cavity. They can thin out to accommodate the distension of the abdomen imposed by the flatus or the gas, fat, fetus in pregnancy and fluid in ascites. See here, this is the skin of the abdomen. This is the skin, and this whole abdominal wall, it consists of many layers. There are 6 layers of the abdomen. Number 1 is the skin. This is the skin. Then when we will remove the skin, there will be superficial fascia. This is the superficial fascia. Okay, then there are many muscles. See here, when we remove the superficial fascia, there are many muscles which are external oblique muscle, internal oblique muscle, transversus abdominis muscle, and there is rectus abdominis also. Okay, then there is a continuous layer of the fascia. See here, this is the continuous layer of the fascia which is named region wise. For example, in the region of the diaphragm, it will be diaphragmatic fascia. In the region of lower part of the abdomen, this will be transversalis fascia, and there is fascia iliaca, or there is thoracolumbar fascia and the pelvic fascia. After removing this layer, there will be extraperitoneal fat. See here, this is extraperitoneal connective tissue. After removing the extraperitoneal connective tissue, we can see the peritoneum. This will be the parietal peritoneum, which provides a slippery surface for the movement of the abdominal viscera against one another. So what is the summary? This is abdominal wall. This abdominal wall consists of 6 layers. Number 1 is skin. Number 2 is superficial fascia. Number 3, there are many muscles which are also in layers. Then there is a continuous layer of the fascia which can be transversalis fascia here. Then there is extraperitoneal connective tissue. And after the extraperitoneal connective tissue, there is parietal peritoneum which is providing a slippery surface. See here in this diagram, they have shown all layers of the abdominal wall. This is skin, this is superficial fascia. Okay, then there will be a deep fascia also. These are the layers of the superficial fascia. Outer one is fatty layer and the inner one is the membranous layer. The fatty layer is named as Kemper's fascia and the deep membranous layer is named as Scarpa's fascia. Then there are many muscles which are here. This is external oblique muscle. After removing the external oblique, we can find the internal oblique muscle, and then there is transverse abdominis muscle. Below the transversus abdominis muscle, there is transversalis fascia. This is endo-abdominal fascia, and here in the region of the transverse abdominis muscle, this is transversalis fascia. Below the transversalis fascia, this is extraperitoneal connective tissue. This is a fat which is extraperitoneal, that is outside the peritoneum. And after this extraperitoneal connective tissue, there is parietal peritoneum. There will be another lecture on the anterior abdominal wall. In this lecture, I am discussing only the introduction. The abdominal cavity is much more extensive than it appears from outside. It projects upward deep to the costal margin. See here, this is the costal margin, and the abdominal cavity will be deeper to the costal margin to reach the diaphragm. It will reach up till the diaphragm. It also projects downwards into the pelvic cavity within the bony pelvis. Thus, it is a considerable part of the abdominal cavity which is overlapped by the thoracic bony cage. This is the part of the abdominal cavity which is overlapped by the bony cage. These are the ribs which are present in the region of the abdomen above and by the bony pelvis below. See here, this is the bony pelvis which is also covering the abdominal part of the cavity. See here, this is the anterior part and this one is the posterior part. These are all layers of the anterior abdominal wall and the posterior abdominal wall. The anterior abdominal wall is also named as anterior-lateral abdominal wall. This is same over the anterior part and the lateral side. So we can call it anterior-lateral abdominal wall. This is skin, then there are many layers of the anterior abdominal wall, and this is the parietal peritoneum. See here, this is the parietal peritoneum, and then there will be visceral peritoneum also. And inside the peritoneum, the two layers of the peritoneum, there will be peritoneal fluid. See here, this is the costal margin. This is costal margin. These are 12 pairs of ribs on each side. But this costal margin, it is overlapping a part of abdomen, okay, which is up till the diaphragm above. And this is the bony cage of the pelvis. So it is covering the part of the abdomen above the pelvic inlet. This is the pelvic inlet. And above the pelvic inlet, this one is the abdomen. And below it, there will be pelvis and perineum. See here, these are the boundaries of the abdomen. Above it is bounded by diaphragm. This is the diaphragm, and below it is bounded by the pelvic inlet. Between the pelvic inlet and the diaphragm, this whole cavity is abdomen. There are many viscera and neurovascular structures which are present in the abdomen. This one is the pelvic inlet, and below the pelvic inlet, the region will be called as pelvis. Again, there is another diagram in which the boundaries or the limit of abdomen is shown. This above it is bounded by the thoracic diaphragm, and below there will be pelvic inlet. See here, this is the pelvic inlet, which is the plane of the superior pelvic aperture. In these two layers or these two boundaries, the cavity is named as abdominopelvic cavity or abdomen. This is abdomen and this one is the pelvis. The abdomen and pelvis collectively it is named as abdominopelvic cavity. But abdominopelvic cavity is divided into two cavities, which is abdominal cavity above and the pelvic cavity below. There are many viscera which are present in the region of abdomen. The visceras will be the lower part of the esophagus. See here, this is the caudal end of the esophagus. It will be continued with the stomach. This is stomach. Then there is the small intestine, and this is small intestine, this whole one, which is divided into duodenum. Then there will be jejunum and ileum. Then it is continuous with the large intestine. This is large intestine. This is ascending colon. Then there is transverse colon. Then there is descending colon. Then there is the sigmoid colon and the rectum and anus. Okay, so these are the parts of the gastrointestinal tract which are present in the abdominal cavity. Along with the parts of the gastrointestinal tract, there are many endocrine organs which are present here, or endocrine glands which are present here. The largest of the endocrine gland is the liver, which is present here. Here there is the pancreas. This is pancreas. There will be gallbladder on the inferior surface of the liver, and there are many components of the urinary system also. The kidneys and ureter, they are also present in the abdominal cavity. Above the kidneys, there will be two suprarenal glands which are present. Along with all these viscera, there are many neurovascular structures which are present in the abdominal cavity. Now we will divide the whole abdomen or abdominal cavity into 9 regions. There are 9 regions with their specific names which are present. 9 of these regions which are in the abdominal cavity, they are used to describe the location of the abdominal organ, or if there is any pain or pathology in some specific region, so we should know the name of the region and the location of the viscera inside that region. These regions, they are divided by 4 planes. See here, this is first plane, this is the second one, then there is the third plane, and this is the fourth plane. There are 2 vertical planes. See here, this is first vertical plane and this is another vertical plane. These vertical planes or sagittal planes, they are named as mid-clavicular line. See here, this is mid-clavicular line. Number one, this is the right midclavicular line and this is left midclavicular line. The midclavicular line means it is in the middle of the clavicle. See here, this is clavicle and this line will pass through the middle of the clavicle. That's why it is named as midclavicular line. This line, it passes from the midpoint of the clavicle, which is about 9 centimeters from the midline of the body. This is the midline of the body and this midclavicular line is about 9 centimeters lateral to the median plane or the midline of the body. This line passes from the middle of the clavicle to the mid-inguinal point. See here, this is the mid-inguinal point. Mid-inguinal point is a point which is in between the midpoints. See here, midpoints of the lines which are joining the anterior superior iliac spine. This is anterior superior iliac spine and the pubic symphysis. That is pubic symphysis. Okay, so we will draw one line which is in between the anterior superior iliac spine and the pubic symphysis. The midpoint of this line is the mid-inguinal point. This is the mid-inguinal point. So the mid-clavicular line will pass through the mid-inguinal point, which is in between the anterior superior iliac spine and the pubic symphysis. I hope you understand the mid-clavicular line. I will repeat it for you. The mid-clavicular line, it is in the middle of the clavicle. It is about 9 centimeters from the median plane. It passes from the middle of the clavicle downwards and it will cross the mid-inguinal point. What is mid-inguinal point? The mid-inguinal point is a point which is in between the anterior superior iliac spine of the pelvis and the pubic symphysis. These were two sagittal or vertical planes. Now there are two transverse planes also, so that these four planes will divide the whole abdomen into 9 regions. The two transverse planes are the subcostal plane. This is subcostal plane. From the name, it is shown that it is below the costal margin. See here, it is touching the inferior costal point. This is the costal margin and this is the inferior part of the costal margin. So this is subcostal plane. And another is the transtubercular plane. This is transtubercular plane. See here, this is the transtubercular plane. Transtubercular plane means the plane which is passing through two iliac tubercles. There are iliac tubercles which are present on the iliac crest. So we will draw one line which are passing through two iliac tubercles. First of all, I will discuss the subcostal plane. See here, this is subcostal plane. It is passing through the inferior border of 10th costal cartilage. This is 10th costal cartilage on each side and this plane is passing through this inferior margin of 10th costal cartilage. If we see the posterior part, it will be at the region of L2. This is subcostal plane. And another plane, that is transtubercular plane, it is passing anteriorly through the iliac tubercles and posteriorly it is related or it is at the level of L5. So what you have to remember, you have to remember L2 at subcostal plane and L5 at transtubercular plane. These tubercles are the iliac tubercles. These are the iliac tubercles and posteriorly it is at the level of L5 and subcostal plane it is at the level of L2. So these four planes, two sagittal and two transverse planes, number one, the right midclavicular plane, the left midclavicular plane, then the subcostal plane and the transtubercular plane, they have divided the whole abdomen into 9 regions. Now what are the names of the regions? See here, this is right hypochondrium. This one, this is the right side, so this is right hypochondrium, and on the left side there will be left hypochondrium. Then in between the right and left hypochondrium there is epigastric region or epigastrium. This is epigastrium. Okay, then in between or middle part, this is right lumbar region in which right kidney is present and left lumbar region in which the left kidney is present. In between the right and left lumbar, there is the umbilical part in which the umbilicus is present. This is umbilical region. Then below, on the right side, there is right inguinal region and on the left side, there is left inguinal region. And in between the two, this is the pubic part part, this is the pubic region. So what are the names? Right hypochondrium, epigastrium, left hypochondrium, right lumbar region, umbilical region, left lumbar region, then right inguinal, pubic region, and the left umbilical region. But we can divide the abdomen into 4 quadrants also by one median plane. See here, this is one median plane which is in the midline of the body, and we will draw one line through the umbilicus, so it will be called as transumbilical plane. So we will divide the abdomen into 4 quadrants also. The right upper quadrant, then there is the left upper quadrant, then there is the right lower quadrant, and there is the left lower quadrant. So these are 9 abdominal regions or areas, and these are 4 abdominal quadrants: right upper quadrant, left upper quadrant, right lower quadrant, and left lower quadrant. Along with the transtubercular plane and the above plane, that was the subcostal plane. See here, this was the subcostal plane, and there was transtubercular plane, okay, which divided the whole abdomen into 9 regions. But additionally, we are using 2 other planes also. Number 1 is the transpyloric plane. See here, this is the transpyloric plane. Okay, this transpyloric plane, it is in midway between the superior border of the manubrium sterni. See here, this is the superior border of the manubrium sterni, and below we will take 1 point at the pubic symphysis. Number 1, we will take 2 points. This is the upper part of the manubrium sterni, and this is the pubic symphysis. We will draw one line here in the median plane, and midway between these 2 points, number 1, the upper part of the manubrium sterni, and number 2, the pubic symphysis. Midway we will draw one transverse plane or one transverse line that is named as transpyloric plane. This transpyloric plane is very important. It is above the subcostal plane. It is at the site of L1. Okay, this question is asked in your exam, that what is the level of the transpyloric plane, or what is the vertebral level, or which vertebra is present at the region or at the site of the transpyloric plane. So this is L1 level. What is the significance of the transpyloric plane? At the transpyloric plane, there are many structures which are transecting. What are they? Number 1, why it is called as transpyloric? Because this plane is passing through the pylorus. What is pylorus? Pylorus is the distal part or the more tubular part of the stomach. So at this site, there is pylorus of the stomach which is present. Number 2, at this site, there is fundus of gallbladder which is present. Then there will be neck of pancreas which is also present at the transpyloric plane. Here at the transpyloric plane, there is origin of the superior mesenteric artery, and the hepatic portal vein is also present at this site. Then here there is the root of the transverse mesocolon. This is the duodenojejunal junction also. That is, the duodenum and the jejunum, they are continuous with one another at this transpyloric plane. And here the hilum of kidneys are also present. Hilum of right kidney and hilum of left kidney, they are also present at the transpyloric plane. So I will revise the transpyloric plane. What is transpyloric? It is a plane or a line which is crossing or which is transecting the pylorus of the stomach. So it is named as transpyloric plane. This plane is midway between the superior part of the manubrium sterni and the pubic symphysis. At this plane, there are many important structures which are present. For example, number 1 is pylorus. Number 2 is fundus of gallbladder. Number 3 is the neck of pancreas. Number 4 is the origin of the superior mesenteric artery. Number 5, there is hepatic portal vein. Number 6, the root of transverse mesocolon. Number 7, duodenojejunal junction. And number 8, there are hilum of the kidneys, that is hilum of right kidney and the hilum of left kidney. This transpyloric plane is present at L1 vertebral level, that is first lumbar vertebral level. Then there is another plane that is named as interspinous plane. See here, interspinous plane means that is the plane which is passing through two anterior superior iliac spines. See here, this is interspinous plane because it is crossing through two spines. So this is interspinous plane. Before we have studied the intertubercular plane or transtubercular plane, which was crossing through two iliac tubercles which are present in the iliac crest. But this is named as interspinous. Spine is because of the anterior superior iliac spine on the right side and the anterior superior iliac spine on the left side. So this is a line which is crossing two anterior superior iliac spines, and this is another plane. We have discussed already that there are four quadrants. These quadrants are formed by two planes. One is the transverse transumbilical plane. This is transverse transumbilical plane, and this one is the vertical median plane. The vertical median plane passing longitudinally through the body, dividing the body into right half and the left half, and the transverse transumbilical plane passing through the umbilicus, and it is at the level of L3 and L4 vertebra, that is the intervertebral disc between L3 and L4 vertebra. This transumbilical plane will divide the whole body into upper half and the lower half. So this is upper half and this one is the lower half. This is the right half and this is the left half. So there are two right and two left halves, or there are two upper and two lower halves. Okay, so what is this? This quadrant is named as right upper quadrant. This quadrant is named as left upper quadrant. This is named as right lower quadrant, and this is named as left lower quadrant. Now, why these quadrants are important? Because in each quadrant there are many viscera which are present, which will show that if there is any pathology or any pain which is present in this quadrant will be related to these viscera. In the right upper quadrant, there is the right lobe of liver, there is gallbladder, there is pylorus of the stomach, there is first, second and third part of the duodenum, there is the head of pancreas, there is right suprarenal gland, right kidney is there, then there is the right colic flexure, there is ascending colon, and there is superior part of the right half of the transverse colon also. Then in the left upper quadrant, there is left lobe of the liver, there is spleen, there is stomach, jejunum and proximal ileum is there. Then the body and the tail of pancreas is present here. There is left kidney, left suprarenal gland, left colic flexure, then transverse colon, which is having the left half here, left half of the transverse colon, and the superior part of the descending colon is present here. Here in the right upper quadrant, superior part of the ascending colon was there. In the left upper quadrant, superior part of the descending colon is there. In the right lower quadrant, we have cecum, we have appendix. Most of the ileum is present in the right lower quadrant, and there is the inferior part of the ascending colon, right ovary, right fallopian tube, right ureter, right spermatic cord in males, and uterus in females, and urinary bladder. In the left lower quadrant, we have the sigmoid colon, we have the inferior part of the descending colon, there is left ovary and left fallopian tube in females, and left ureter, there is left spermatic cord in males, and uterus in female, and urinary bladder also. Now, what are the functions of the abdomen? The abdominal cavity or abdomen is housing and protecting the major viscera. See here, all major viscera, they are present here, which are gastrointestinal and urinary viscera. Okay, so it will accommodate the gastrointestinal system, the spleen and the urinary system. Much of the liver, the gallbladder, the stomach and spleen and parts of colon, they are under the dome of the diaphragm. See here, this is the dome of the diaphragm. The superior pole of kidneys, they are also deeper to the ribs. The viscera not under the dome of diaphragm, they are supported and protected predominantly by the muscular wall of the abdomen. See here there will be muscles which are protecting the abdominal viscera, which are not covered and protected by the ribs. Now, the abdomen will help in the breathing. It is one of the most important role of the abdominal wall to assist in breathing. What happens in breathing? it relaxes during inspiration. See here, this is in inspiration, the abdominal wall muscles, they will be relaxed. When they are relaxed during inspiration, they will accommodate the expansion of the thoracic cavity. The thoracic cavity will be expanded in inspiration, and it will displace the diaphragm, and now the diaphragm will be displaced downward, and there will be contraction of the diaphragm and the inferior displacement of the abdominal viscera. So what will happen in inspiration? Number one, there is relaxation of the abdominal muscles, expansion of the thoracic cavity, contraction of the diaphragm will come downward, and there will be inferior displacement of the abdominal viscera. But in expiration, what will happen? It will contract the abdominal wall muscles, they will be contract. Okay, when they contract, they assist in elevating the dome of diaphragm. The dome of diaphragm will go above, and it will reduce the thoracic volume. Okay, so materials can be expelled from the airway. See here, it can be expelled from the airway by forced expiration using the abdominal muscles, such as in coughing and sneezing. There can be changes in the intra-abdominal pressure. The contraction of the abdominal wall muscles can increase the intra-abdominal pressure when the diaphragm is in fixed position. See here, the diaphragm is in fixed position. The contraction of the abdominal wall muscles will increase the intra-abdominal pressure, and it will help in the micturition, it will help in the defecation, or it will help in the parturition. See here, this is anterior lateral abdominal wall. These are the muscles which are present anteriorly. This is rectus abdominis muscle. This is external oblique muscle, internal oblique and transversus abdominis muscle. Okay, this is the peritoneal cavity, and there are many viscera which are present here. So this was the introduction of the abdomen. I hope you understand. Thank you very much.